So I told you earlier on the news that about 600 million people on the continent are lacking essential healthcare services. But now we have top African health tech startups that are actually seeking partnership with government to scale healthcare services to be provided for this population of people. And now to help us understand this better, I have Zillah Waminaje, who is a research analyst. Zillah, it's nice to have you around on the news. Thank you.
Hello, good evening. Thanks for having me.
So how have partnerships between health tech startups and African governments contributed to addressing the continent's health challenges? We'll pick it from there because we're looking at a deficit of about 600 million people lacking essential health services.
Yeah, so in the course of our research on African health tech innovations, and we've been doing this work since I think 4 or 5 years now, when we focus on these health tech innovations, especially looking at the health supply chains, we've seen about 50 partnerships existing between these health tech startups and the government, and the most common type of partnerships we see are between government and innovators who provide these order and inventory management solutions to basically ensure that people have access to quality medications at the hospitals, clinics, and pharmacies whenever they need them. And now the question is, how are they doing that? And what they do is that they provide digital marketplace solutions where these healthcare providers, the clinics and what have you, are able to procure high quality medications from, like, we have manufacturers or the distributors, and also they provide them with this inventory management solution so that they are able to see, have visibility on their products to reduce like stock out rates at the hospitals, and also just to reduce waste. Another, will I say, group of innovators that we see working with governments to improve healthcare services on the continent are these product protection and visibility innovators. What they do is that they work with both governments and manufacturers to track the movement of products from like the manufacturers down to the last mile healthcare facilities, and also helping to reduce, the amount of counterfeit drugs that we have in the market. And just to give you an example, like with their authentication services, you could, for example, just go to the pharmacy before you buy your drug. You see a code at the back, and then you just send the code to just through SMS to a phone number, just to verify that, oh, this product is actually authentic and maybe has been validated by the NAFDAC. And even when we look at these underserved areas and hard to reach communities, that is where people are actually need this access to like essential healthcare services. We see innovators that offer medical drone delivery services, working with governments to ensure that services are able to be delivered in these communities, especially during emergencies. So there are a lot of partnerships that have been ongoing, but the major question right now that we have is, how can we foster more of these partnerships, and integrate these innovations into routine public health delivery services across the continent?
So how can that be done? Because I want to believe that there are limitations. I'd like you to first share the limitations to these innovation by these health tech startups and what can be done to scale to ensure that we have a spread of these services to those that are in need of it.
One of the key challenges that comes up when they work with government, with the partnership between innovators and government, is payment delays, And what we do is that we'll be advocating to donors, to help provide like revolving funds that can help to de-risk this type of partnerships, to say, help to just create this fund so that innovators have access to like working capital to actually implement their operations and then deliver services together with government. Also, innovators have told us that they struggle with like macroeconomic challenges, like inflation, currency depreciation. And in trying to solve for that, what they're doing now is trying to seek how to generate like Forex, in their revenues. For example, maybe pricing their services in foreign currency where possible, or maybe just expanding their operations to other African markets, that have more stable economies, just to de-risk their operations. And another challenge that these innovators face is brain drain. Over the past decade, you've been seeing the news of the migration of highly skilled professionals moving abroad, and how this startups are still trying to, will I say, get a work around this, is like, okay, let's just optimize for talent rather than location. So they're adopting this kind of global distributed team model, just to make sure that they still have these highly skilled professionals that are able to work with them to deliver the innovations.
It's quite nice to see that technology is scaling all the hurdles to ensure that a health service delivery is provided. But then I'd like to find out from you, because we discovered that there's Mpox outbreak on the continent, more pronounced in Congo as we speak. Now, what ways do you think that health tech services can be provided or can come into this to actually mitigate the impact on the continent when we're talking about major crisis, and probably when we also talk about response time and management of situations like this? How do you think that health tech services can come into play?
Yes, you're correct. The Mpox outbreak just been declared a public health emergency of international concern. And then if you remember in 2022, when we had the COVID-19 pandemic, health tech innovations were definitely leveraged by the government. If I want to use Nigeria, for example, we saw the National Primary Healthcare Development Agency, that's the NPACDA, collaborating with a health tech company, Figure, and what they did was that they leveraged the company's coaching solution to implement their vaccine distribution campaigns across the country. And even once that after the campaigns were done, once we're done with the pandemic, they subsequently extended this solution, to also even track other childhood vaccines delivered nationally. And I think that just goes to show how effective it was in supporting the agency for them to be able to expand to other places. So that is one way. I believe that even in this Mpox situation, once the vaccine campaigns kick off, this is a potential solution that might be leveraged by the government to ensure that there's full visibility on how these vaccines are being distributed, making sure they are delivered under the right circumstances, to make sure they don't lose their, will I say, quality, because they need to be stored. They are temperature sensitive products, And also we see some health tech innovations. I know like eHealth Africa has a lot of disease surveillance tools, and they often work with government agencies like the NCDC to just help in terms of disease surveillance, data analytics, and the rest of them.
All right, the fact that even Nigeria is championing this cause makes it a win for Africa because of its capacity. Zillah Waminaje, research analyst, thank you so much for your time on the news.
Thanks for having me.